Maine Med as an institution is a great balance between community hospital and tertiary care center.
Maine is very unique in the sense that family medicine is really incorporated in the medical community on all fronts.
Integrative medicine to me is the way of providing primary care, and it just gives me so many more tools to take care of patients.
Within that classic medical center with med students and residents and fellows, people appreciate that we are one of the specialty services.
I felt very, very supported through residency and equally through fellowship.
I get regular check-ins and they make sure I'm doing okay.
The Integrative Medicine Fellowship Program started in 2003. The program itself is centered around the Arizona Center for Integrative Medicine Fellowship curriculum. Didactic aspects of the program come from the Helms Medical Institute.
Providers in the group have done the Helms course, and I really enjoy learning from them and getting the practical experience.
They get put into a faculty role as part of their fellowship, and I think that's a good learning opportunity for them.
You have to practice what you're teaching, so it definitely resonates more if you're able to use those practices yourself. I definitely encourage us to get our feet wet and try things.
They're involved in writing, they're involved in research if they're interested.
If you come in with a special interest, there is broad discretion to be able to set that up.
It's got kind of a nice balance between scholarly activity and clinical activity. We've managed to develop and maintain great relationships with the community providers.
It's nice to practice this type of medicine, which tends to be thought of as alternative, but in a way that our community makes it a regular part of practice.
They all have slightly different backgrounds and perspectives and areas of passion.
Part of the goal is to develop integrated medicine doctors who have great health and great work-life balance.
Just sort of naturally, they were supportive of taking time for family and self-care as needed.
Maine itself is such a beautiful place. There's the sea, there are the mountains.
We've loved living in Portland. We've really enjoyed the food scene here, the restaurant scene.
This great city offers so much in terms of urban living as well. I have a family and it's a great place to raise kids.
Once I did the fellowship, it felt like home.
Most of our fellows stay in Maine. We get to continue working with them and being in contact with them after we're done.
I'm very pleased to be here and plan to stay for a long time.
This is probably one of the most comprehensive integrative fellowships that I've come across. There's also a lot of free rein to learn what you're interested in.
They get a lot of experience by the time they've done their fellowship.
The practice I got seeing patients made me so much better of a primary care doctor.
Our ultimate goal is to be good doctors and not to make it a separate program at all, but something that most primary care physicians would think about if they feel like their patients would benefit.
I found that it fit my needs in terms of becoming the provider that I want to be.